Hi, everyone. Good afternoon. For years, heart disease has been the number one cause of death in the US, followed closely by cancer, accidents, respiratory disease, and stroke. But COVID-19 continues to climb towards the top of that list. Today, we're joined by Dr. Kirk Knowlton, Director of Cardiovascular Research and the Chair of the Cardiovascular Department at Intermountain Medical Center, to talk about the links between COVID-19 and heart disease. Dr. Knowlton, thanks so much for joining us. It's nice to see you.
Thank you. It's wonderful to be here. Thanks for letting me take a few minutes.
Of course. And February is also Heart Month. So this is a great topic, especially for this time as we kind of wrap up this month of awareness and kind of educating the public. So I'd like to start with an overview of the connection between COVID-19 and heart disease. Can you give us that information?
Sure. I think this is a question that's on a lot of people's mind now as they think about people who get COVID and whether they should seek treatment. I think there are a couple of overview points that we want to make. One is that there are still a lot of people who are afraid to seek medical attention when they really need medical attention because they're afraid they might get exposed to COVID when they come into the hospital. And really there is, the hospitals are very well prepared to make sure that people are safe from COVID exposure, et cetera. And it's really important given the urgency of heart disease and stroke. When people are having a heart attack, they need to come in right away to be seen. If they're having a stroke, it's really important that they come in right away. And there have been too many stories of people who unfortunately are afraid they'll get COVID and wait, and either they complete a heart attack or a few have even died at home before they come into the hospital. So that's a real problem that we worry a lot about, is making sure that people come in to get treated. Then there are other things too. One of the things I think people think a lot about now is, I've had COVID. Do I have heart disease? I've read that people can get heart disease after they've had COVID. And it's pretty clear that COVID can affect the heart in a minority or a subset of patients, usually those who are fairly severely affected by COVID, but not only those. And maybe you'll want to talk a little bit more about some of the recent studies that look at the post-COVID effects as well. And then other things that I think are important for people to remember about the relationship between COVID and heart disease is that when people get COVID, if they have underlying heart disease before they got COVID, they are at a significantly higher risk of complications that are related to COVID infection, like having to use a machine for ventilation or even death. They're higher risk of death and so on. So I think it's important for listeners to remember that if they have family members or they themselves have heart disease, it's even more important to get them, to keep them from exposure to COVID, and also to be aggressive about getting them vaccinations. And so I think those are three major points. And then I just put in a big plug for the vaccine is really a wonderful tool. It's probably the best tool we have to make sure we don't get COVID-related heart disease.
And for someone who maybe has never seen signs or symptoms of heart disease before, what are some things that you should look out for if you maybe have, it runs in your family, there's other people who have gotten heart disease before? What are some tells and tales that you can kind of look for?
Right. So these are things that are kind of independent of COVID that are really important because a lot of them overlap with COVID symptoms as well. But the classic thing that people talk about with heart disease is what they call chest pain. But people get misled by that because sometimes it's not really a pain. I say, oh, I didn't really have pain. What I felt was more of a pressure or a heaviness on my chest, or maybe in my throat, or radiating down one arm or the other. And it's especially important if it's related to exertion. That helps us to know that it's more likely related to heart disease, like a young lady recently who had a family history of heart disease. And she called me and said, I'm on the elliptical, and after 2 minutes, I start to get pressured chest discomfort. I get off, it goes away. I said, listen, we need to take care of you right away. And she was taken care of right away. And And similarly, there can be, that usually is not a heart attack, but the prelude to a heart attack, perhaps. When a person's having a heart attack, it could be while they're resting or while they're watching television, or could wake them from their sleep. It usually doesn't go away. It might be associated with shortness of breath, with sweatiness, with generally just not feeling well. And sometimes that feels more like a pain, they'll say, because of the severity of it. So that's one of the big things that gives an indication that one of the arteries to the heart is closing or is closed, and it needs to be open, or it needs to be treated in some fashion. So that's one of the big ones we think about. Another one is shortness of breath and the inability to do things that a person was once able to do. Maybe they used to be able to climb to the top of Mount Olympus, and now they're noticing that, gee, I can barely get up to the top of Ensign Peak before I get short of breath. And that should cause some concern and some evaluation. It's not guaranteed that it's heart disease. It could be lung disease, but it could be heart disease or vascular disease, a different kind than I described before, where maybe the heart's not functioning as well as it should. A third thing is people might feel their heart racing, or palpitations, we call them, or they may feel dizzy or lightheaded if their heart is going too slowly. So I think those are some of the major constellations of heart disease that we look for, heart disease symptoms, to help us to recognize when someone should be evaluated for heart disease. Family history makes a big difference too. If you have a strong family history, we can test genetics now to find out if you have familial hypercholesterolemia or something as well.
Is there any difference between males and females too with heart disease? Does one gender typically get heart disease more than the other, or is it kind of a disease that doesn't technically care?
That's a great question, and there are differences, but the important thing is they're not as big a difference as women like to think that they are. So men tend to get heart disease at a younger age, maybe around a decade on the average. But women can also get heart disease. In fact, heart disease is not only the leading killer of men, it is also the leading cause of death among women, even more than cancer, which surprises some women. The other thing to be aware of is that that generally women will have similar symptoms to men when they have heart disease, they'll still experience many of the symptoms that I just discussed with you, but they might have somewhat different symptoms as well. They can be a little bit atypical compared to what a man might have. So I think that it's important for women to remember that definitely heart disease can be a disease of women. And the story I told you about on the elliptical, that was a young woman with familial hypercholesterolemia, and fortunately she was taken care of because she was aware of what could happen.
Sounds like knowing your family history is really important too, and making sure that if it's something that your family is familiar with, that you kind of read up on this. Yes. I want to go back to COVID and kind of talk about the tie between these two. There was a recent study published in the European Journal of Medicine, I do believe, that talked about that a month after discharge with hospitalized patients of COVID, heart disease was still present in about 54% of those patients. Can you explain a little bit more about that study and what it means for you as someone who looks at this every day?
Right. So I think the fundamental concept here is that there is objective evidence that some people who have had COVID can have evidence of heart disease, looking at objective imaging studies, as can occur with cardiac magnetic resonance imaging. It's called cardiac MR. People may have had MR scans for their knees or their back, but it can also be useful in the heart to look at the heart in qualified centers where they have a specialist who specializes in that. It's a little bit trickier than a knee because it's moving all the time. But I think that the key thing, focusing first on that study you mentioned that was published out of the United Kingdom, I think it's important to recognize that, yes, that study definitively showed that a subset of patients who were hospitalized and were quite sick had evidence of heart damage afterwards. Some of them had heart disease before they got COVID. About two-thirds of them or so, or a third of them had heart disease before they got COVID. And it's also important to recognize that they focused on people who had evidence of heart damage while they were in the hospital. And that ended up being, around a little over half of the patients, of the total number of patients that had some evidence of heart disease. That's a little higher than most people report. COVID usually is reported as causing 20 to 30% of evidence of heart damage. And then of those, there were 820 patients who had positive troponin, a measure of heart damage. And it ended up they only did cardiac MR on a relatively small percentage of them, 8%. But of those, 54% of that 8% had evidence of heart disease or heart damage. So I think it's important not to be overly alarmed. It's not a huge percentage, but it's definitely a potential problem. Other studies have shown even higher percentages of abnormal cardiac MR, even in people who are not as sick, as high as 75% in one study that came from Germany. And another study, though, performed by a group at Vanderbilt showed a relatively small incidence of myocarditis, classic myocarditis, which is a classic inflammation of the heart. But they also showed other abnormalities that we haven't really clearly defined yet. So I think that's the study that came out from one of the European journals, perhaps the European Heart Journal, really showed that, once again, there's evidence that COVID can affect the heart. And there are a variety of mechanisms by which that can occur.
So you mentioned myocarditis, and I hope I'm saying that correctly. And we talked about this, it's probably been about 8 months since we talked about this last, and how that was something that we were really worried about in athletes. It's been some time since we've kind of talked about that. Have we learned anything about myocarditis and how much it affects someone, specifically an athlete as well?
Right. So that, I think we all remember the college football season being truncated for some of the teams, including the league that our University of Utah Utes are playing in was delayed in starting. And it was because there was some evidence that even healthy athletes could have heart damage in up to 30% of them. So that after they'd had COVID, subsequent studies have demonstrated that it's not quite as clear that higher percentage. It's actually a very small percentage, only 2 or 3% that might have some evidence of myocarditis or heart damage. Consequently, that's one of the reasons that they went ahead and opened the leagues so that people could play. But it still highlights that, even in these healthy people, things can happen. We have a lot of young college kids. It's okay, I'm just going to get a little bit of a cold and I'm going to be okay. I'll try not to visit my grandma while I'm sick because I don't want to get her infected. But they forget that maybe there are long-term effects that we haven't fully grasped yet that even can occur in some healthy younger people.
Speaking of that too, I want to get a little bit more specific on what COVID-19 can do to your heart. What actual effects does the virus have?
Right. So I think there are several layers that we could focus on. One would be symptoms. Maybe I'll start there. One would be, what's the physiologic effect on the heart? And then if we get time, what are some of the molecular mechanisms, which I like to think about as well. But the symptoms tend to be people are experiencing more shortness of breath than they would expect. That's a little hard to tease out from the lung disease that's caused by COVID. Some people have chest pain and continue to have chest pain after their COVID. And it's not clear, how much of that is heart disease, how much is muscles and their musculoskeletal system. So that's one that is that people complain of. Another is palpitations, where their heart feels like it's skipping beats or beating fast. And then a number of miscellaneous things. But I think of these, the shortness of breath is sometimes the most troubling, because it is possible for the virus to infect, the actual virus can infect the heart itself. Recent study in February, in fact, did autopsy on people who had died from COVID. And by far the great majority of them had evidence of the virus itself in their heart, even though they didn't have necessarily a lot of inflammation around this infected cells. It did affect the heart. And we now know that it can activate a different kind of inflammation. It can cause clot to form in arteries in the heart, small vessels, large vessels. It can cause clots in the arteries to the lung, known as pulmonary emboli, and so on. So those are some of the mechanisms by which the virus can cause shortness of breath, and it might affect the heart function. Maybe it makes it so it doesn't contract as well, or maybe it just gives it a little inflammation around the covering of the heart. We call pericarditis or myopericarditis. And so that's one of the things that can happen. And some arrhythmias can occur from that infection as well. And then, anyway, those are the main points, I think, from that.
And if you happen to have been hospitalized for COVID-19, do you recommend that they undergo a cardiovascular exam as a safety measure? Is that something that we've been doing with our patients? Is that required or recommended?
I would say it's not recommended at this point in time. So if a person is discharged from the hospital after COVID and a month later or so, they're feeling quite well, they feel like they're mostly back to themselves, there can take time to get fully recovered, but they're back to themselves, they're probably doing fine. And their heart is probably doing fine. And that's the great majority of people who have been hospitalized with COVID. If, on the other hand, the person had evidence of heart damage when they were in the hospital, as measured by a marker in the blood called troponin that's released from the damaged heart muscle, then, and they're having symptoms, the shortness of breath, consistent chest pain, palpitations, or evidence of arrhythmias, then I think that would be the time to seek medical advice, especially if it's going on a couple months, 3 months, 2-3 months, 1-2-3 months, depending on the severity of the symptoms, to seek some medical advice as to whether this might be related to one's heart.
Outside of contracting COVID and that relating specifically to heart disease or heart damage, what's important for the general public to know about heart disease in general?
Outside of COVID, you're talking about now.
Yeah, so should someone be doing routine checkups with their doctor? I know we've talked a little bit about if you start to experience signs, but is there stuff that you should routinely be doing as with like your annual appointment, or anything that should kind of be a part of that treatment plan that you're doing?
There are, Amanda. Thank you. That's a great strategy. We talk a lot about knowing your numbers, and there are a number of things that are very important to focus on when you see your physician. Blood pressure is important marker. It can be an important risk for heart disease. So know if you have high blood pressure and get it treated if you do. Know if you have diabetes and get it treated if you do have diabetes. The other one that I think people tend to overlook is their cholesterol. We talk a lot about cholesterol, but it's surprising how many people don't know about their cholesterols. And the American Pediatric Society, American Pediatric Association actually recommends checking cholesterols at very young ages, by the time they're teens, to make sure they don't have familial hyperlipidemia or evidence that something they can start treating early. So I think everyone pretty much should have their cholesterol checked at least once. Know your numbers. That's one way you can find out whether you're at increased risk, and then talk to your doctor about whether you need to be treated for that as well. Your weight is important. Obesity can be a risk factor for heart disease. And then start, outside of your doctor's appointments are things like a good diet, exercise, don't smoke. If you do smoke, that's probably the biggest risk factor you've got, is a preventable risk factor. You can't change your parents. So genetic risk factors cannot be changed, but they can be treated. However, smoking we can stop. And difficult, but it can be done. And so I think those are important things to consider as we think about trying to prevent heart disease. Yes.
I was going to ask you about things we can do at home to kind of help prevent those heart diseases. You mentioned exercise and a proper diet. Is there anything else that we can do in our daily lives that would help us reduce that risk?
I think those are the, those are the most important ones, which includes, along with diet, includes the fact that diet and exercise help us to maintain a good, healthy weight, which helps to prevent type 2 diabetes and helps to prevent hypertension. In people who have hypertension, they probably need to watch the salt intake as well in their diet. If you have hypertension or one has heart failure, then those are times when we need to watch the salt intake. And it's not so much about how much salt we shake on our food, it's what's in the food that we eat. We think a can of beans is nice and healthy. That is pretty healthy for most of us. If you have hypertension or heart failure, look at the sodium content. It's almost your maximum. The Heart Association recommends 1,500 milligrams a day, 1,500 to 2,500, but it's close to 800 on a can of beans. So you have to be careful where your salt comes from.
That's interesting. You brought up beans. I know I've always been taught to rinse off beans to kind of get rid of that sodium level. And I don't know if that actually does it, but it's just something I've always been taught to do.
Frozen beans are really good that way.
Last question for you.
Yes.
So given this connection between COVID and heart problems, how important is next week's vaccine rollout to those who are 18 plus with certain medical conditions?
Well, we can't wait for it in our household, and we're really excited that this is coming along, because I think this is the really big opportunity to start to vaccinate large percentages of the population who are at risk of the things we just talked about. That the people who have existing conditions like heart disease, hypertension, obesity, these are things that put people at higher risk of hospitalization, of complications from COVID. So I think it's really important to take advantage of that. I hear a lot of people, not a lot, actually Utah's been very good at getting people vaccinated and using their vaccines, and I'm pleased to see that. But there are people who are nervous about getting a vaccine. I ran, the minute I got an email that said you could sign up in 20 minutes, I was signed up for 2 days down the road. I was very excited to get the vaccine. And I think that there are a lot of misconceptions that people have about the vaccine, that seek out as much knowledge as you can about how to approach this. I think is really, if you're nervous about getting it, talk to someone who's knowledgeable about it, because it's been tested in many people now. There are some side effects, but I look at it as, wow, I know it worked. I know it's working. It's activating my immune system a little bit. So anyway, there are a lot of things I could talk to you about the vaccine. I'm very excited about the vaccine, and I think it's really one of the keys to me being able to get together with my grandchildren again.
I think that's a great personal touch to it, is kind of figuring out how the vaccine applies to your life and how it can make it better. So I think we're all pretty excited about that. I know I told you last question, but I have one more for you.
Of course.
So we, in a press release that we sent out, we talked about 20% of patients with COVID come out with heart problems, which you kind of addressed this at the beginning, but what is the typical percentage of the people that are passing away from COVID having heart complications? Is that something that's been studied well?
Yes.
Do we know a lot about that?
Yes, we do. I don't know if I have the exact numbers on the top of my head right now, but of people that pass away, at a minimum, we can say a much higher percentage of them had evidence of heart disease to start with, or hypertension, or obesity. As many as in my mind, I'm thinking about 50 or 60% of them. a significantly higher percentage than people who did not have pre-existing conditions. So heart disease plays a role in that. And it could be that they had heart disease and COVID made it worse. I think that's a big factor, but also COVID can have a direct effect in activating the immune system, which can have negative effects on the heart on top of what might already exist there. So that's a good reason to get the vaccine, because especially if you have heart disease or pre-existing conditions, it really can help reduce those risks, because these are the people that are at increased risk, and that's why they're going quickly to start to be able to vaccinate those.
I think that's a great note to end on. And if anyone has any questions around the COVID vaccine, we have a website that people can go to. It is intermountain.com/COVID vaccine. It is a great list of resources for people to look at, from what's in the vaccines, the safety of it, and we will be talking about the distribution of that as well, with more information for next week coming soon. Dr. Knowlton, thank you so much for joining us. We really appreciate it, and we'll talk to you soon.
You're very welcome. Thank you very much.
Thanks.